My doctor says I need surgery. I know you are a surgical nurse. Do you have any advice for me?
Have you chosen a surgeon yet?
Yes.
Who is it?
Dr. Lesion.
Have you already been to see him?
Yes, my surgery is scheduled for tomorrow morning.
It is too late to be asking my advice.
Why? Isn't he a good surgeon?
He would not be my first choice.
My doctor recommended him.
Doctors don't necessarily recommend surgeons because they are competent. They recommend them because they play tennis together, or perhaps because they both drive Jaguars.
Why didn't you tell me this before?
Why didn't you ask me before you selected a surgeon?
I didn't realize it was so important.
What type of anesthesia are you having?
I don't know. Does it matter?
No, you are too stupid to know the difference anyway. Who is driving you to the surgery center?
No one. I'm driving myself. They are only operating on my hand. I can drive with one hand.
Did your surgeon tell you someone must drive you home after surgery?
Yes, but he tells me a lot of things. Why can't I drive myself home? I can drive with one hand.
The anesthesia provider will give you stupefying drugs during your surgery. You will not be permitted to drive yourself home after receiving mind-numbing drugs.
I will ask my neighbor to drive me home. He is 85 and has nothing else to do.
Is your 85-year-old neighbor a good driver? Is he capable of helping you into the house if you are drowsy?
My neighbor drives to bingo every day in his 1964 Fairlane sedan, and he seems to be able to get his walker into the trunk without any problem. I'll buy him breakfast on the way to the surgery center, and that will make him happy to sit in the waiting room until my surgery is finished and I can go home.
Didn't they tell you not to have anything to eat or drink after midnight the night before your surgery?
Not eat breakfast? How can I not eat breakfast? I will be starving.
You cannot eat breakfast. You cannot have coffee or juice or anything. The drugs you receive during surgery could make you sick to your stomach and you could throw up.
I do not want to get sick. I do not want to go hungry. I do not want to bother my 85-year-old neighbor. Why do they make this so complicated? It's just surgery on my hand. I'm going home the same day. It can't be that involved.
You are making my eyes bleed. I am going home to rest.